Okay, let's dive right into this explainer, where we are tackling some truly high-stakes, microscopic medical math. We are looking at exactly what it takes to prepare a sight-saving eye injection, specifically diluting the antibiotic vancomycin for intravitreal use. We're going to break down the precise mathematics required to safely scale down a massive dose of medicine for one of the absolute most delicate organs in the human body.
Here is our step-by-step agenda for exactly how we're going to walk through this chronological journey of a single drop. We'll hit the endophthalmitis protocol, starting with the 500 mg powder vial, the first dilution step, extracting the 10 mg dose, the second dilution, and finally nailing that perfect intravitreal dose.
Kicking off with Section 1, the endophthalmitis protocol. We really need to establish the severe medical context of this procedure first.
To really appreciate the wild level of precision required here, you have to understand the stakes we're dealing with. We are talking about postoperative bacterial endophthalmitis. This is a severe, potentially devastating infection inside the eye that can happen after surgery. To treat it, medical professionals use an intravitreal approach, meaning the medication is injected directly into the vitreous body, the actual fluid inside the eye. Because the eye is this incredibly small, closed, and fragile system, there is literally zero room for error. If the dose is too weak, the infection could cause permanent blindness. But if it's too strong, the chemical toxicity of the drug itself could destroy the patient's vision.
And the standard dilution protocol acts as a brilliant master roadmap for this entire explanation. It's essentially a single flowchart detailing exactly how to prepare vancomycin for this incredibly delicate environment. We're going to deconstruct every single step of this sequence so you can see exactly how the fluid dynamics and the math work together to save a patient's sight.
Moving to Section 2, the 500 mg powder vial. This is where we look at the massive discrepancy between the drug we have and the drug we actually need.
We begin with a whopping 500 mg of vancomycin powder. Now, this is just a standard vial size you'd find stocked in any hospital pharmacy. But for an injection directly into the eye, 500 mg is a blunt, enormous dose. It's an overwhelming amount of medication typically designed to be diluted for systemic use throughout the whole body, usually infused through an IV bag. Definitely not placed into a tiny, self-contained organ. So our mathematical challenge begins right here with this large, solid number.
Contrast that massive powder vial with our ultimate microscopic target. We need just 1 milligram of medication to safely treat the eye. Think about that scale for a second. We have to perfectly reduce our starting material by a factor of 500. And we have to do it in a way that is easily replicable, perfectly sterile, and mathematically flawless while under immense clinical pressure. So, how do we safely get from 500 all the way down to 1 using just standard medical fluids and syringes?
Let's find out in Section 3, the first dilution step, adding 10 milliliters. What's really interesting here is how we take our very first step to bridge that massive gap.
The protocol strictly instructs us to first add 10 milliliters of sterile diluting fluid, something like sterile water or saline, directly into that 500 milligram powder vial. By mixing it until it dissolves, we transform our dry, powdered medication into a workable liquid solution.
And here is the critical conceptual leap. This perfectly deconstructs the math. By adding those 10 milliliters, we now have a solution where 500 milligrams of the drug is swimming evenly inside 10 milliliters of fluid. If we mathematically divide both of those numbers by 10, well, we see that it's the exact same concentration as having 50 milligrams in 1 milliliter of fluid. And if we divide that by 5, the math shows us this ratio is mathematically identical to having 10 milligrams of drug in just 0.2 milliliters of fluid. You see, the concentration is completely uniform throughout the vial. We just need to pull out the exact volume of liquid that gives us the weight of the drug we want.
Let's move to Section 4, extracting the 10 milligram dose. Let's see how taking 0.2 milliliters builds toward our final microdose.
Armed with that exact math, the flowchart tells us the next step is to simply pull 0.2 milliliters from our initial mixture. By using a very small, precise syringe to extract just 0.2 milliliters of liquid from that newly mixed vial, the physical properties of our dilution absolutely guarantee that we have exactly 10 milligrams of vancomycin in our hand. We have safely left behind and discarded 490 milligrams of the drug without doing any complicated scraping or weighing of raw powder. We literally just let the fluid proportions do all the heavy lifting.
We are getting closer, but 10 milligrams is still 10 times too strong. That brings us to Section 5, The second dilution step, making it 1.0 milliliters.
So, the crucial point is right here. This is where we weaken the concentration. We take that tiny 0.2 milliliter syringe that's holding our 10 milligrams of medication, and we make it 1.0 milliliter by drawing up an additional 0.8 milliliters of plain sterile fluid. We haven't added any more of the actual drug, right? We've just added water. Now, that exact same 10 milligrams of vancomycin is spread out evenly across a full 1 milliliter of fluid.
Finally, we have reached the exact scale we need. Section 6, the final intravitreal dose, which is 1 milligram in 0.1 milliliters. The final step is to take just 0.1 milliliters. Because we perfectly suspended 10 milligrams of the antibiotic into 1 full milliliter of fluid in that last step, taking 1/10 of that volume means we must be holding exactly 1/10 of the drug. So we extract a microscopic 0.1 milliliters, giving us exactly our target dose, 1 milligram of vancomycin in 0.1 milliliters of fluid. It is an incredibly small volume. It's essentially just a single, perfectly calibrated drop.
Let's lock in these 4 simple vital physical actions. Step 1. Add 10 milliliters to the massive powder vial. Step 2. Take out 0.2 milliliters. Step 3. Add fluid to bring that volume up to 1.0 milliliters. And Step 4. Extract just 0.1 milliliters. 4 steps to safely transform a massive 500 milligram powder vial into a perfectly balanced 1 milligram microweapon against endophthalmitis. It's basically practical mathematical perfection. As we wrap up this explainer, I want you to consider this. What if a single decimal point is misread during this process? What are the devastating consequences for a patient's vision? It leaves us to really consider the immense stakes of these simple fractions and why absolute precision in medical math is quite literally the difference between permanent blindness and a complete cure. We've seen how easy the math is when it's laid out step by step in a controlled environment, but imagine executing this in a high-stress, real-world clinical scenario with the clock ticking. It really makes you deeply appreciate the rigorous structured protocols that keep patients safe every single day. Thanks for joining me on this deep dive into the math of medicine. Keep asking questions and keep learning.